Hello everyone and welcome to AceOSCE's video for today. I am Alicia and thank you again for joining me so much. On this video, I'm going to give you a brief overview of the NAPRA's drug scheduling and why they schedule a specific medication in a specific schedule. There are a few different methods of drug scheduling in Canada. The most common ones are the NAPRA, which I'm going to discuss today, and the second possible one is the Food and Drugs Act drug classification. It is a good idea to know about this a little bit just in case you get any questions in the PEBC evaluating exam from this topic. Letting you know that it's usually Schedule F that includes the prescription medications in the list in the Foods and Drugs Act. We will be discussing the NAPRA drug schedule as an overview at this point in time. This is quite a large topic. Again, all topics are large, I guess, in the PEBC evaluating exam. But I wanted to give a quick overview so everybody knows or has a little bit idea of what drug scheduling is, why it's a specific way, and what are the possible things they keep in mind. So the NAPRA drug schedules as prescription or available for self-selection, keeping the following factors in mind. So the reasons why a specific drug is put in a specific schedule as per NAPRA have the following reasons. The first reason could be the condition that the medication treats. So medications such as diabetic medications or hypertension medications need to be followed up regularly by the physician to make sure that they are still the best option for the patient, which is why they are usually prescription. Side effect profile of medications. So for example, Tylenol and Advil in the lower strengths are available over the counter because the side effects are not too much. On the other side, medications such as statins or other meds, they can have bad side effects such as muscle aches and liver impairment, which is why they are Schedule 1. Monitoring needed when the drug is taken. For example, methotrexate needs regular checkups by the doctor or yearly exams for eyes and lung functions. So they would need to be monitored by the physician, which is why they are usually Schedule 1. Then comes the therapeutic index of the drug. So therapeutic index usually defines how a small quantity of the medication can alter the action of the medication in your body. Such drugs like lithium or digoxin can cause pronounced effects with small dose changes, which is why these are a little dangerous and need constant assessment from the prescriber, making them Schedule 1 or prescription only. Then comes the risk of toxicity. So salts such as iron salts, ferrous fumarate, ferrous gluconate, or iron salts in general may cause toxicity if taken in amounts more than needed by the body. As a result of which, even though iron is not a bad thing on its own or a big medication on its own, it is still Schedule 2 and is kept inside the pharmacy and not available for patient self-selection. The last, or usually this one, is the pack size of the medications. The bigger the pack size, the more prescription needed. NAPRA drug scheduler for a particular drug can be found on the NAPRA website and under the drug scheduling tab. This is a common question. PEBC expects you to know where to find the drug schedule of a specific medication. So if you go onto the NAPRA website, you'll be able to see a little tab which says search the drug by DIN or by keyword or by the generic name. So whenever you're able to have a quick look, definitely go in and have a quick look at it. Here's a little screenshot of that website. So this is the NAPRA's website of the National Drug Schedules. You can either download the app or you can search them by the drug name or a keyword such as the brand name, or if you scroll down, you'll be able to see other search methods as well. So if ever anybody asks you how to find a drug schedule, you know where to look for it now. The next thing I want to kind of share with you is about something called locks and leaves. So I'm from India. I did not know that there's a concept called locks and leaves here in Canada. So medications that are Schedule 3, which can be kept outside the pharmacy for patient self-selection, but need the presence of a pharmacist to be sold, and therefore can only be shown to the patient when the pharmacist is in the pharmacy per se. So for example, if the pharmacy is located in a busy grocery store where the grocery store is open and the pharmacy is closed, these lock and leaves help. So this is going to be a little example of what a lock and leave looks like, where the pharmacist can open this shelf when they are on duty and can close it when the store is open but the pharmacy is closed and there is no pharmacist on duty. This little shelf can house all Schedule 3 medications, so patients can still have a look at it when the pharmacy is open, but it is closed and not available for self-selection when the pharmacy is closed in the absence of a pharmacist. Again, this is what a lock and leave shelf looks like. I am going to make a quick tabular form about the NAPRA drug schedules, because that ways we can compare the examples and what are the different factors that make a schedule 1, 2, 3 or unscheduled, and I'll give a little information about each. So in this table that I've made up, it does show the NAPRA drug schedules on the left, which show schedule 1, 2, 3 and U, which stands for unscheduled. The first column says needs a doctor's prescription. The second one says kept inside or outside the pharmacy, which is the dispensary area of the pharmacy. And the third one is available for patient self-selection. That means it's usually kept outside the pharmacy in the over-the-counter section. Now the first schedule, or schedule 1, are medications that are prescription only and they need a doctor's prescription to be released from the pharmacy. For example, Ramipril, amlodipine, your diabetes medications, etc. They are only given out with the doctor's prescription, so they are usually schedule 1. These are usually kept inside the pharmacy and not available for patient selection. So if the prescription is for Ramipril and the patient says, oh no, I want candesartan, you cannot give it because you only have a prescription for Ramipril. Schedule 2 include medications such as EpiPen and iron. Just giving you guys a little clarification, in Canada, usually EpiPens and iron medications may be covered by Ontario Drug Benefits or say seniors drug plans, which cover for medications for 65 years of age and older. Therefore, in those cases, you may need a prescription in order to put it through patient's insurance. But if the patient is paying by cash, they do not strictly need a prescription, and these can be given with just the pharmacist's advice over the counter. So this is usually kept inside the pharmacy, behind the counter, not over the counter, and they are not available for patient self-selection. So for example, if a patient comes and wants the EpiPen, you have the right to assess the patient because it is schedule 2 and it needs the pharmacist's intervention. So you can assess them if they need it or not, especially say things like beta blockers that may decrease the effect of an EpiPen, or use your clinical knowledge and professional judgment before you give that or recommend that to a patient. Schedule 3 medications such as Gravol and Benadryl do not need a prescription from the doctor. They're usually kept outside. If there's a small community pharmacy which closes, where the store is closed at the same time as the pharmacy is closing, at that point in time you do not need lock and leaves like the image that I showed you before, because the pharmacy closes at the same time as the store and the patients do not have access to those medications. However, if the pharmacy is located inside a grocery store where the grocery store is open even when the pharmacy is closed and the pharmacist is absent, in those cases that pharmacy would need lock and leave shelves if they want to carry any schedule 3 medications, so that the pharmacist can make sure that he's present whenever such medications are being sold. These medications are available for patient self-selection as these are usually kept over the counter. And however, again, these are different from unscheduled medications because a pharmacist is needed in order to sell these in case the patient has any questions or concerns about these medications. The last one is U or unscheduled, such as Tylenol and Advil. These do not need a prescription. These are usually kept outside. They may be also sold in convenience stores because there's no pharmacist intervention needed. These usually have very less side effects and are not as toxic or do not have any toxicity potential for patients. And usually the boxes have all the information in case of directions, in case of how many tablets should be given out to the patient. So it's quite easy for patients to have access to this. And these are available for patients to self-select, so these are usually kept outside. Again, this is the only class of medications that can be sold without a prescription and can be sold in a place other than a pharmacy, such as convenience stores or dollar stores where patients can get this medication. I just wanted to highlight that there are some medications that may have 2 schedules depending on the pack size. So if the pack size is bigger, then it's schedule 2, otherwise it's schedule 3. Again, if you guys have any questions about this, again, this was an overview video. It is a big topic to cover, but I tried to cover as much as I could. I hope that this gives you guys a little bit clarification about how NAPRA schedules its medications and why it schedules certain medications in certain ways. Again, if you guys have any questions, feel free to DM me or reach out to me on any of these platforms that I've listed here. And if there's any other videos or you want to do some classes with me or even enroll in my mini mocks, let me know. Have a good day for yourself, guys.